Hi, this is Ian Wright, and this is the sixth in the series of podcasts about specific learning and behavioural disorders in children, and we've covered ASD, autistic spectrum disorder, we've covered DCD, developmental coordination disorders, sensory processing disorders, ADHDs, and I'm just going to look, this one is going to be entitled the kind of crossover between behavioural disorders, anxiety, and specific learning difficulties in children. And these cross over so much that it's quite impossible often to work out what is the primary issue, because the symptoms overwhelm so much, and nearly always you're going to have more than one of these together, because if you have a child who's feeling different from the rest of the peer group and they're not able to learn as easily, or they have they notice they're having coordinational difficulties, or if they have ASD issues where there is a primary difficulty in communication and peer group connection, or ADHD where you have impulse issues, it's going to create behavioural disorders. And because the reason why they will be behavioural disorders is that it makes it much harder for the child to fit in within their social grouping. I mean, the first question you have to ask in this is, what is wrong behaviour and what is right behaviour? Because, a child who has difficulties sitting down, let's say a boy who's 5, 6, 7 years old, who is fidgety, has difficulty sitting down. Now, in certain parts of the world, like America, this child could be diagnosed with ADHD and given, central nervous system stimulants like Ritalin, etc., to allow them to sit down. Now, there's a question in that, of course, which is, surely maybe this child just doesn't need to sit down yet. Maybe this child needs to be playing more, being out in nature, and then naturally will come to a place where they want to sit down. So that whole massive discussion, which I started talking about last time, about what is society's needs and what are our own needs, in the end, we have to relate to our peer group. But there should be obviously some flexibility. Now, this whole idea of a behavioural disorder has to be used cautiously in children under 5, because it's very hard to distinguish what is normal and what is not normal, because they're changing so rapidly. I think we could call it really more behavioural issues as opposed to behavioural disorders. A disorder is too strong a word. Anyway, so under the kind of blanket terms of behavioural disorders in children, you have ADHD, ASD, you have anxiety disorders, which I'll come to in a minute, you have depression, you have actually specific learning disorders, and then you have things like ODD, oppositional defiant disorder, and conduct disorders. Now, oppositional defiant disorder is classified by the classic kind of psychiatric book DSM-4/5 from America as having symptoms for over 6 months. They tend to be angry, irritable, resentful, but the real key to oppositional defiant disorder is they're defiant. They argue with authority, they have issues following rules, they deliberately upset people, they actively refuse. Now, I'll talk about the causes of that later. That crosses over and connects to some of the conduct disorders, which again is qualified by difficulty following rules, substance abuse, they have difficulty going to school, and they have difficulty in behaving in a socially acceptable manner. They can be aggressive with bullying and causing others physical harm, or destructive, like lying and stealing. This is normally classified as 3 types. One is a childhood conduct disorder, which is pre-10 years old. Adolescence is the obviously teenage. And then there's more of an unspecific one, which is not really related to a specific age of onset. Now, these can link with what's called prosocial disorders, meaning a lack of understanding of society. So they're these children can be non-emotional or callous, and that's slightly rarer, actually, I think. I mean, you do see it, but it's rarer in children. There's often a strong genetic thread in that. I mean, the thing is, again, talking specifically of behavioural disorders, what causes it? Now, we've talked a lot in the last few times about neurodevelopmental issues, about the way the brain develops and some issues that can cause problems with that. And we've talked about pregnancy, and we've talked about birth trauma. Birth trauma can set up, a lot of tone in the nervous system, and which can be very subtle but have an effect on the development of the nervous system. But there are specific genetic causes as well that can cause problems with impulse control, which we've seen in ADHD, or regulation of part of the nervous system called the prefrontal cortex, which helps us regulate our behaviour, especially when we're teenagers. But then when you're looking at these primary behavioural issues, there are environmental and social issues, stress in the family, dysfunctional family, going all the way along to, child abuse, parents who have addictions, drugs and alcohol, etc. Poverty is highly linked to it. So you have this plethora of causes, which all cross over each other when you have to kind of pull out the threads. For me, we have to pull out the threads. How do we actually diagnose what's going on here? Let me just mention for a second anxiety and depression, because these are really common. And I know I've done lots of previous podcasts on anxiety, and I'm writing a book right now on how to work with anxiety disorders. This one's more for adults. But, there's general anxiety disorder, which is a general state of anxiety. You have specific phobias, panic attacks. The symptoms in children are concentration issues, sleep issues, as in difficulty getting to sleep. They have bad dreams. They tend to eat. They have eating issues. They eat poorly or overeat. They tend to worry and have lots of negative thoughts. They have a sense of overwhelm and an inability to cope with their day-to-day life and their school. They can cry a lot or be fidgety, clingy. And one big one I see every day in practice is they complain of tummy aches. Now, if you look at the symptoms, the classic symptoms of depression in a child, the child is sad, anxious, feeling hopeless, a lack of joy. They have sleeping difficulties. They have poor concentration. They have appetite change. They can complain of tummy aches. So these symptoms, to separate anxiety and depression is sometimes very hard, and you can have both. But concentration issues, sleep difficulties, overwhelm, these can be the symptoms of a child with DCD, ASD, ADHD. You see where I'm going? It's how do you separate these? But what happens if you do have ADHD or ASD or dyspraxia or severe dyslexias, etc.? You can get anxiety and depression, and that can be an overlay of that. Either effect has an effect on a child's nervous system, so it sets up the tone in their nervous system, and their HPA, hypothalamic pituitary axis, gets stimulated. They produce more stress hormones, adrenaline, norepinephrine, and cortisol, and these can have an effect on the body, and they can create more anxiety. The effects of cortisol on the body has a direct effect on the amygdala, part of the brain that is very important with regards to anxiety disorders. So how do we separate these things? How do we pull out the different threads? And do we need to? Us as osteopaths are looking at causative factors. What in their environment or what in their physiological makeup is affecting them, and seeing how we can affect them. If there's strain patterns, if they're holding stresses, if there's tummy stress, or if there's specific neurodevelopmental issues, which we want to look very precisely at what's actually going on. And what I love and what I'm fascinated by in these children is trying to unravel the puzzle, and it's like almost unraveling a knot, and you're trying to find the different threads in the knot, and it's a complex knot, and everything's not quite working right. And if we can start to unravel parts of them and support them in the right ways, get their bodies to de-stress, sort out their diets, find other helps, supportive helps that could be necessary and helpful for them, tease out factors that are in their environment which can be not supporting, sleep, etc., or nutrition. Finding out if they're actually if they are really stressed about this, and do they need to talk about that? There's so many different ways in here, and I think the research saying that maybe 15% of children in the US certainly suffer behavioural disorders as children. It could be more, and it's certainly increasing, but we have to tease out what's going on with these children and really be quite precise, I think, about how to address these issues for them, even if they are issues in their environment. If there's a lot of stress in the family, fine, we'll try and find out and work with that. Maybe we need to treat mum because she's very stressed or whatever, or she's depressed herself, and it's reflecting. Children are like sponges, they pick up what's around them very strongly, and especially very sensitive children. They can become the sponge for the family stress, and that's something we need to see and work with that and change that dynamic in them if we can, or help that in some ways. Anyway, this is a huge subject and we can talk about this all day. Anyways, I wish you well.